In this video, I'll share how the United States employment legislation protects employment privacy. These 6 acts shown in the boxes are listed from earliest to most recent. They'll be covered in summary format, indicating who they apply to, the provisions and compliance requirements. The website where the full act can be found is provided. The Social Security Administration, SSA, of 1935 was signed into law by President Franklin D. Roosevelt in 1935 and created Social Security, a federal safety net for elderly, unemployed, and disadvantaged Americans. The main stipulation of the original Social Security Act was to pay financial benefit to retirees over the age of 65 based on lifetime payroll tax contributions. The Act also established the Social Security Board, which later became the Social Security Administration, to structure the Social Security Act and figure out the logistics in implementing it. It is an independent agency of the United States federal government that administers the Social Security Program, a social insurance program consisting of retirement, disability, and survivors' benefits. Tens of millions of people in the United States have received financial assistance through the Social Security Act since its inception. Still, the program was wrought with challenges from the start and has been politically a hot topic for years. Its existence has been threatened constantly. The Social Security Administration administers the Retirement, Survivors, and Disability Social Insurance Program, RSDI. It is a federally funded program designed to ensure the continuation of income to those who are disabled, have reached retirement age, or are surviving dependents of those who qualified for Social Security, or are the surviving dependents of those who qualified for social disability insurance. The program is the largest income continuation of its sort in the United States. Retirement income. Retirees qualify for full RSDI when they reach full retirement age if they're insured under the SSDI, generally if they have worked 10 years or more in the United States. Full retirement age is 65 years old for anyone born before 1960 and 67 years old for anyone born since 1960. Partial benefits may be obtained by covered retirees beginning at age 62. Survivor benefits. Survivors include widows, widowers, and dependent children of deceased persons who were covered by Social Security disability insurance. In some cases, it is also available to grandchildren, stepchildren, adopted children, adult disabled dependents, and dependent parents. Widows or widowers are entitled to RSDI benefits if they're over 60 years old. They may qualify at a younger age if they are disabled according to Social Security disability standards. A widow or widower also qualifies if they are the primary caretaker for the deceased's children under 16 years old. Dependent children typically qualify for RSDI if their parents were covered by Social Security disability insurance until they're 18 years old. Children still in high school qualify until they are 19 years old. Disability benefits. Those who are completely disabled according to the Social Security disability standards also qualify for RSDI. To qualify based on disability, you need to show that you are completely incapable of performing any work for which you are qualified due to a physical or mental handicap. Medicare is the United States government's health insurance program for people age 65 or older. Some people under age 65 can qualify for Medicare. They include those with disabilities, permanent kidney failure, or amyotrophic lateral sclerosis. Medicare helps with the cost of health care. It does not cover all medical expenses or the cost of most long-term care. The program has 4 parts, which is shown on the table. Part A is hospital insurance, Part B helps to pay for medical services that Part A does not cover. Part C is called Medicare Advantage. If you have Part A and Part B, you can use this option to receive all of your health care through a provider organization like an HMO. Part D is prescription drug coverage. It helps pay for some of the medicines. The administration for Medicare program is the responsibility of the Centers for Medicare and Medicaid Services, but Social Security Administration offices are used for determining initial eligibility for some processing of premium payments and for limited public contact information. The federal wage garnishment law is found in Title III of the Consumer Credit Protection Act, CCPA of 1968, and applies to all employers and employees. Employers are required to withhold funds from an employee's paycheck and send the money to an entity designated in the court order or levy document. Title III of CCPA protects employees in 3 ways. Prohibits employers from terminating employees whose wages are garnished for any one debt, even if the employer receives multiple garnishment orders for the same debt. It sets limits on the amount that can be garnished in any one single week. Currently, the weekly amount may not exceed the lesser of 2 figures: 25% of the employee's disposable earnings, or the amount by which an employee's disposable earnings are greater than 30 times the federal minimum wage, currently $7.25. Earnings that may be garnished includes wages, salaries, bonuses, and commissions. Other income from pensions or employer-paid disability may be subject to garnishment as well. The law does not protect employees from termination if the employer receives garnishments for more than one debt. The Fair Credit Reporting Act, FCRA, of 1970 was the first major legislation to regulate the collection, dissemination, and use of consumer information, including consumer credit information. It requires employers to notify any individual in writing if a credit report may be used in making an employment decision. Employers must also get a written authorization from the individual before asking a credit bureau for a credit report. The Act also protects the privacy of background investigation information and provides methods for ensuring that the information is accurate. Employers who take adverse action against a job applicant or current employee based on information contained in the prospective or current employee's consumer report will have additional disclosures to make to that individual. Congress enacted the Uniform Services Employment and Reemployment Rights Act, USERA, in 1994 to protect the rights of reservists called to active duty in the armed forces. The Act provides reemployment benefits rights and is administered through the Veterans Employment Training Services, VETS, of the Department of Labor. USERA applies to all public and private employers in the United States, including the federal government. The DOL issued revised rules for employers that became effective on June 18, 2006, that clarifies some of the requirements previously issued. The law applies to virtually all employees, and there's no minimum number of employees or other limiting thresholds. USERA provides that returning service members are reemployed in the job that they would have attained had they not been absent from military service. That is a long-standing escalator principle, with the same seniority, status, and pay, as well as the rights and benefits determined by the seniority. USERA also requires that reasonable efforts, such as training or retraining, be made to enable returning service members to refresh or update their skills to help them qualify for reemployment. The law clearly provides for alternative reemployment positions if the service member cannot qualify for the escalated promotion. USERA also provides that while an employee is performing military service, he or she is deemed to be furloughed or leave of absence and is entitled to the non-seniority rights accorded other individuals on military leaves of absence. USERA provides protection for disabled workers, requiring employers to make reasonable efforts to accommodate the disability. Service members convalescent from injuries received during the service or training may have up to 2 years from the date of employment of service to return to their jobs or apply for reemployment. The Dodd-Frank Wall Street Reform and Consumer Protection Act, commonly referred to as Dodd-Frank, was a response to the 2008 global financial crisis and intended to prevent a similar instance. The act brought the most significant changes to the financial regulation since the regulatory reform that came following the Great Recession. It made changes in the financial regulatory environment affecting all federal financial regulatory agencies and almost every part of the financial services industry. Since the 1980s, banks and other financial institutions have paid notoriously high salaries to their executives, sales individuals, and other high-level employees. Following the financial crises, compensation arrangements in the financial sector have come under increased scrutiny. Dodd-Frank addresses this issue of pay and incentives most clearly in two distinct areas of the Act: the proposed rules governing bonuses and the pay ratio disclosures requirements. For global payroll and stakeholders at financial institutions and publicly traded companies, these provisions are critical to understand. If any adverse action is taken against an applicant or an employee, either in part or whole because of information contained in a consumer report, additional notification requirements include the individual's credit score that's used, the range of credit scores possible under the credit scoring model used, each factor that adversely affected the credit score, date score was created, name of the reporting agency, or the person who furnished the credit score. The Patient Protection and Affordable Act of 2010, also Affordable Care Act, or colloquially known as Obamacare, is a United States federal statute that was signed into law by President Barack Obama on March 23, 2010. Together with the Healthcare and Education Reconciliation Act of 2010 amendment, it represents the United States healthcare system's most significant regulatory overhaul and expansion of coverage since the passage of Medicare and Medicaid in 1965. The Act required all citizens and legal residents of the United States, adults and children, to maintain health insurance coverage. If they're not included in the employer's health care plan, they're expected to purchase it on their own. Those who do not purchase coverage pay a penalty. The Act's major provisions came into force in 2014. By 2016, the uninsured share of the population was roughly cut in half, with estimates ranging from 20 to 24 million additional people covered. The law also enacted a host of delivery system reforms intended to constrain healthcare costs and improve quality. After the law went into effect, increases in overall healthcare spending slowed, including premiums for employer-based insurance plans. This provision was repealed by the Tax Cuts and Jobs Act of 2017, but the individual mandate will stay in effect until 2019. The law sets certain standards that all insurers must meet and mandates that all health plans offer to those who buy health insurance on their own or in small groups included a set of essential health benefits. These are noted in the left column. Preventative care in the center column must also be included, and the right column indicates what the coverage mandates.